You are listening to part 32 of our series, 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Thank you, Gemini. So let's see. Last week we were talking about acupuncture and then some related and probably older techniques, moxibustion and cupping. Did you go back to the acupuncturists? Did you find out anything about cupping?
No, I did not get a chance to go back to the acupuncturist. No, I did not. But when you were discussing cupping, I kind of had some silly memories from being a child when we would put those glasses over our lips and suck in real hard. And then, of course, trying to get them off, and our mothers telling us our lips were going to, stick out and be fat like ducks. And when we were kids, I don't know if you remember that. They were like little Tupperware glasses. Just silly stuff. But it made me laugh.
And I think that that you said that you went trolling about and found some images of cupping.
I did. Last week after you had discussed it, I looked it up, and wow, it looked like somebody pummeled someone with their fist, just these round spots all over their backs. And I was like, oh my goodness, I can't imagine.
It doesn't feel bad. So long as you don't see it, you can't feel it.
Right.
Right? Remember, right? So long as you can't see what's going on. And I think this is why it's so often used on your back.
Yeah, because if you weren't expecting that, it would be astonishing if you saw yourself.
Yeah, you look like a little Dot the Polka Dot girl.
Yes. Do they do that on other areas, like, your thighs, or you have maybe a little bit more space, versus your calves or something like that?
Yes, you can do cupping anywhere.
Okay. Wow.
Yeah.
Yeah, I highly recommend people view images of it.
Yeah.
So that they're not surprised.
It's a European technique as well as an Oriental technique. So it's part of the Western understanding, although we didn't develop, as the Chinese did, this deeper level of the meridians with the energy flow and the points. I'm not saying that there aren't individual people in the Western tradition who didn't come to that on their own, but it wasn't codified in the same way.
Okay.
And this week, we're going to be looking at bodywork. We could just generally call it massage. And I had people really get upset with me about putting massage in with alternative medicine. They think that it should be somewhere else. And when I ask them what other medicine they think it should be, they're not quite sure. And that is true. That's very true. And part of the reason that's true is because there are a lot of different kinds of massage. And there are a lot of ways that we can relate to the massage. So let me tell you what I'm thinking about putting it in alternative medicine. And first of all, it is that most massage stimulates and sedates. Just as we saw with acupuncture, it may be an interesting and exotic theory and technique, but when we come right down to what it does, it is stimulating and sedating. And that's true for virtually all forms of massage as well, that they are either stimulating or sedating. And somebody said to me, quite concerned, well, what's wrong with that? And I said, it's not that there's anything so wrong with it. And I'm, by putting it in alternative medicine, by saying that there is some slight erosion of health, I'm not damning it or saying that these are things we shouldn't do, but simply that we need to be aware of them. I said, but more to the point, I find that people will use massage as a way to not have to take care of themselves. And last month when I was teaching at Roe Camp and Conference Center, there was a therapist there. And we were talking about this, and I said to her, do you ever see that? And she said to me, I see that all the time. That people come back to me over and over and over again for help with the same issue in the body. And I say to them, if you wouldn't cross your legs, this wouldn't happen. If you would be aware of your shoulders, this wouldn't happen. If you would sit in a different way in your chair, this wouldn't happen. She said, and they won't take care of themselves. They just keep coming back for massage. And this is part of the reason that I want us to think about massage as being alternative medicine. In other words, what we really want to do is to take care of our bodies, to use ourselves wisely, to engage in the kind of physical exercise and the kind of learning that we get in either Tai Chi or Qigong that helps us build a body through which our energy can flow and flow well. If we do that as part of our lifestyle, then we don't need massage to do it for us. Now, that doesn't mean we don't need massage. It doesn't mean we don't want massage, because on the other side of this, and there was a person in the room when we were talking about it, and she said, well, that's not what I get from massage. She says, I go to get a massage, and I'm just putty. I am just nothing. I said, Serenity medicine. She said, yes. My mind goes to lunch. My body relaxes. Everything is right with the world. I said, wonderful, wonderful. Yes, massage can be Serenity medicine. She's not going for a massage to help her deal with a problem, a structural problem that she is causing or exacerbating. She's getting that wonderful relaxation response, which is one of the major goals of Serenity medicine, is to be able to let ourselves completely go, completely trust, not have a thought or a care in the world just for the time of the massage. It's okay. We'll all come crashing back. Don't worry. These things will never totally leave you, but you can at least, have a moment there. This certainly does not even begin to cover what is available to us as Bodywork, even in a particular area. If we were simply to say, I would like a Swedish massage, which is a pretty standard massage taught at all massage schools, you would probably find in most areas a good couple of dozens of practitioners of Swedish massage. And because the Swedish massage is not a set rote of you have to do this and this and this, there's an individual variation certainly allowed within it, you would probably find 24 different massages. I know that I was quite thrilled, having been introduced to them in the West Coast, to find an Oriental massage parlor opened up in my nearby town called Happy Feet. Yes. So we tried it out. We took our feet to Happy Feet, and we got the Happy Foot massage, and we were happy. We were very happy. And my gym partner and I decided that every 8 times we went to the gym, we could get a foot massage. So that would be our spirit amusement there for going to the gym. And then, of course, we heard behind the closed curtains the massages, so I decided one day that I was going to do that. And that was one of the deepest, strongest massages I've ever had in my life. And this was a very intense and very deep massage with a lot of action, times that I really had to just bite my tongue and bite my lips to keep from screaming out. And certainly far beyond what I had expected. I am not in any way complaining, but trying to make the point here But if we say massage, we are not being specific. That even within a specific kind of massage, there's going to be enormous variation. And then there are even the different kinds of groupings. We talked about acupuncture last week, and we talked about how acupuncture is, with the needles, the actual puncture is a new technique that has been around for 65, 75 years, and that was preceded by pressure in those meridian points, pressure on the tsubas, exerted with a thumb, a finger, an elbow, a tool. And this, of course, is what we call a Shiatsu massage. And this Shiatsu massage, the original Shiatsu massage that I experienced when Shiatsu was very new to the United States, actually did involve someone walking on my back. And that was brilliantly done. I mean, the person who was walking on my back had an amazing understanding of what was going on in a human back and quite flexible toes that were doing a job of kneading in my back that hands simply couldn't do. Also very interesting to me in this Shiatsu massage was the diagnosis. And the diagnosis was done by massage. And that was, for me, the first time that I had seen anyone ask the body in such a direct fashion what was going on. I was more used to a Western model where we ask the body, give us some of yourself, and then we're going to use our instruments to see what was going on. But in this case, the Shiatsu practitioner used her hands, very sensitive hands, to massage my belly and to move things in my belly, and made a diagnosis of what kind of points needed to be in the Shiatsu massage based on that diagnosis. So once again, we are stimulating and sedating. The goal here is to do the diagnosis. From that diagnosis, understand where there's an energy deficiency and to bring energy to that area. And to understand where the energy might be stagnant and might need to be moved along. Another memorable massage that I had was a massage for which I'm sure I was given some kind of name. And I'm pretty sure that name was repetitive and alliterative. And when I tell you it was some kind of Polynesian massage, you're going to agree with me that it was probably repetitive and alliterative. And the massage took place with two naked bodies, both of which were covered in all surfaces in coconut oil. And the massage therapist then proceeded to use every possible surface of her body to massage my body. So rather than using her fingers and hands and thumbs to massage my arm, she might trap my wrist between her knee or her thighs and then use her lower arm to massage up and down my arm, or use her entire thigh to massage against my shoulder. it was not erotic. There wasn't any eroticism about it. It was a massage, and it was one of the most thorough and flowing massages that I've ever had for most people. And again, no complaint. There's a kind of standard pattern to a massage. You lay down, then massage your back, then massage your arms, then massage your legs. Sometimes they turn you over and do a little massage on the front. And this was, you never knew what was going to happen next. You never knew what part of your body was going to be massaged and what part of her body was going to be in contact with your body. So is that a massage that's alternative medicine? For me, it was a gift of energy and sensation. Since it was a one-time thing, there's certainly no possibility for it to erode my health, because we have to repeat the use of the stimulant or sedative for that erosive effect to take in. And I certainly didn't become dependent on it. Although, if given the opportunity, I would certainly say yes to another one. Perhaps the most subtle body work. That's actual body work. We're not talking Reiki or hands-off healing here. Actual body work is cranial sacral work. Have you ever had any cranial sacral work done, Gemini?
I'm familiar with the term, but I've never had it done.
Yeah. So we know when we're born that our skull is not fused. We talk about the baby's soft spot and the softness of the baby's skull. Cranial sacral therapists say that those sutures, that's what they call them in the brain, not in the brain, I'm sorry, in the skull, are always a tiny bit wiggly. And that you can wiggle them. And that's cranial sacral work. And the practitioner literally puts their hands on your skull and moves about the various parts of your skull. It sounds a lot stranger than it is. It sounds really weird. It sounds kind of like they're sticking their fingers in your mouth and your nose. And I'm not saying they never do, because they will occasionally. They need to get to some inner part of the skull. They will, with the gloves, will move in where they need to move in. But usually cranial sacral work is very, very relaxing and calming. But the goal is the same. Energy is stuck, and it needs to be released. Energy is not getting through to places, and it needs to be brought to those places. We are going to increase what's happening in one place, decrease what's happening in another place for stimulating and sedating. Another way that we can have a sense of the fact that it belongs in alternative medicine is to find out from practitioners, would you say that this would be effective if somebody came for one session? And if something is nourishing, then it is going to be effective in one session. If it is tonifying or stimulating, sedating, then there are going to need to be repeat sessions. With a tonic, we'll remember that the repeat sessions give us that and give us that increased ability. But with a stimulant or a sedative, although we also get good from it, we don't ourselves retain that good. And that's been my experience with the cranial sacral work. Wonderful. Felt great. Very useful for the difficulty that I was experiencing at the time needed to have quite a few sessions and not an onerous amount, reasonable amount. And it got me through an acute phase, but it didn't seem to do a whole lot for me for the chronic thing. Now, that is possibly because I didn't really do as many sessions as was suggested due to time limitations. So again, this is wonderful, fabulous technique, and it is definitely here in alternative medicine. It's not something we're going to be doing for ourselves. We're going to need to find somebody to help us do that cranial sacral work in the same way that we generally need someone to do the physical therapy for us. That when we are in a situation in which physical therapy is called for, it's going to be something that we could take into our lifestyle, but we're going to be initiating that by going to someone who's going to help us with that physical therapy. And this is an excellent point for us to remember that this is indeed the goal, that we move from alternative medicine back to lifestyle medicine, that we take what we can, the getting over that acute phase so that we can get back into doing more good for ourselves with lifestyle, or the actual help to change a chronic problem. And then again, taking that back into our lifestyle. Physical therapists have this really well down because their goal is not to only stimulate and sedate, but to have you take that back into your life and make it a permanent part of your life so that the benefit keeps on coming to us. What other kinds of massage have you experienced, Gemini?
I have never had a massage.
That's
astounding,
an amazing
I know.
statement. My goodness.
Never. I've had acupuncture. I've had adjustments on my back, but I've never had a massage. It's on my list to do. I just never have.
Well,
Sounds wonderful.
I commend you for having it on your list, and perhaps you'll use this week's theme to get you out and onto a massage table somewhere. All right. Watch out for those happy feet places. They do great feet. That's really intense massage.
Okay.
Especially for a first massage, you would probably want to ask for a relaxing massage.
Okay.
You would not want a deep tissue massage. It sounds good, right?
It does.
It sounds like the special, at the restaurant, the deep tissue massage. But for the first massage, it's not what they want. I remember when one of my students who had worked with me and then gone to massage school and was doing some specialized training came and said, I would like to, give you a massage with this new technique I've learned. And I'd had massages from her before as she was learning, and she was very good. And she started doing this technique, which was called deep tissue work. And I could not resist screaming. I was really screaming. And she said to me, "Oh, that's so wonderful." I said, "What is so wonderful?" "You are hurting me." And I am screaming. She said, "When my teacher did that to me, I leapt off the table and hit him alongside the head." She said, "And you're just lying there and screaming." She said, "Good
job."
What? Wait a second. So the idea here is throughout a massage, the idea is that the muscles themselves, because they are made of very long fibers, get tangled like your hair gets tangled. And you know how you put your fingers in your hair and you kind of pull on your hair and it kind of pulls the tangles out? And the idea is that the massage strokes are straightening those strands and bringing them back to alignment. And so the deep tissue work, rather than working on the muscle fibers with the strokes of massage, intends to go into the places where the muscles are attached. And that can be a normal and natural place where the muscle is supposed to be attached. And those places often get really, they say kind of like a lot of energy can get like into that area, which is why we get joint pain. Or areas where there are adhesions within the muscle tissue itself, or areas where the muscle is stuck to the fascia. And the fascia is a thin membrane that connects body tissues together and lies between the skin and the deeper tissues. There is a massage technique that I was shown in Germany. I didn't get the massage, but they showed me what the technique was. I wasn't so sure that I would like it, in which and you can try this out. So you can reach out to your arm, and you can pick up a piece of skin on your arm. And most of us, when we do that, we're going to pick it up going along the length of the arm. Now pick it up going across the arm. And so the massage is, they start there, and they work that pinch of skin all the way up your entire arm, right, and then do it all the way around, and your legs and your back, right. And they're punishing things that happen where it doesn't pull up, because that means that the fascia is adhered there. And many of these techniques where you're not loose and flowing, what they do to get you loose and flowing, really, you really think, how can it hurt that much? How could this one little spot that's being touched hurt so much? And this is what they're getting at. What they're saying is, you may feel fine, but I'm going to poke you right here. And you are going to discover that this fine is because you have actually pulled the wires out of your ability to perceive how much tension is in your muscles right now. And how much that tension in your muscles.
Like you're describing, that would be very difficult. Like to pick up the skin going the other way.
Yeah, and roll it up your whole arm or your whole leg. That's why I said, no, I think this one I will write.
I just tried that. It actually hurts.
Yes, yeah. A lovely massage that I experienced was called Watsu. And this is water Shiatsu done in a very large hot tub.
Mm.
The hot tub is big enough for you to float in, and the practitioner floats you and turns you and massages you and does a variety of different things that can't be done on a table, because in the water you're totally supported.
Now, that sounds more like my speed.
Yes, so that one I said yes to. So what are we saying here? We're saying here that massage is wonderful. We're saying that massage is a marvelous way to take care of yourself. We're saying explore massage. Get some body work, but be aware that there are varieties of massage, from gentle stroking, a nice relaxing massage, to we are jumping up and down on you and really getting into the deepest possible areas. Massage is great. Alternative medicine, the Fifth River, will be back next week to talk about hydrotherapy.
Thank you, Susan. That was fun.
Thank you, Gemini. Green blessings to everyone. And remember that herbal medicine is people's medicine. It's the medicine of the people, for the people, and by the people. Till next week, then.
We'll see you next week, Susan. And this concludes part 32 of our series, The 7 Medicines, The Wise Woman Way with Susan Wade at Time Monk Radio.